entrust us with one of their most precious possessions. John is dear to them and a hero. We honor John by conducting ourselves as though the family were present. We treat John with respect and dignity above all else.
That's a mock exercise by Hoosier healthcare workers training to give the gift of life. The Indiana Donor Network says it's overcome a long list of challenges this year to set an all-time record for the number of life-saving organs transplanted. By October, the nonprofit organization had shattered last year's number, which puts it on pace to increase the number of organs transplanted by more than 30%. Business of Health reporter KYLIE VELETA has more. KYLIE.
Thank you, Gary. Like many medical procedures, organ donation took a hit during the early days of the pandemic, but the organization says it stared down a long list of challenges to persist in its life-saving mission. With more than 2 months left in the year, the Indiana Donor Network blew by its 2019 record of 665 organ transplants. President and Chief Executive Officer Kelly Hanner joins me now to tell us how the organization has been able to thrive despite this challenging year. Kelly, thanks for being on the show today.
Thank you for having me.
Well, the Indiana Donor Network is calling 2020 a historic year for saving lives. What are some of the numbers that your organization is proud of that you'd like to share?
Well, we are really proud to say that as of today, 232 Hoosiers have given the gift of life through organ donation. That's resulted in 784 life-saving organ transplants so far in 2020. So we are on pace to increase organs transplanted by about 31% this year over last year.
Those numbers really are remarkable considering the challenging year that it's been in the medical industry throughout 2020. How was your organization able to respond when the COVID-19 pandemic hit so unexpectedly? What did you do to persist?
Well, it was certainly challenging, but early on we partnered with the Indiana State Department of Health to test all of our potential donors for COVID-19. And then, of course, patients who tested positive couldn't become organ donors because of health risks to the transplant recipients. But we also adapted our staffing guidelines to reduce our team's exposure to COVID-19. We started working and communicating with families virtually of potential organ donors. Prior to the pandemic, though, most family contact had been in person. So we had to just kind of change a little bit on the fly.
I imagine those conversations on devices had to be difficult. Those are really sensitive topics, and having to do those on devices, was that a hard transition to do?
Yeah, it certainly is more difficult. It's hard to sometimes make a connection with a family, but I think that, we're very fortunate that we have so many Hoosiers in Indiana that are really willing to give the gift of life to others in their time of need and to think about others when they're going through something quite terrible for themselves.
Well, another big accomplishment in 2020, your organization opened the Organ and Tissue Recovery Center in Indianapolis in May. Explain what that is and some of the advantages it gives you.
Sure. The Indiana Donor Network Organ and Tissue Recovery Center, it's our state-of-the-art facility that allows us to transport donors to Indiana Donor Network for on-site organ and tissue recovery. It includes an intensive care unit, 2 surgical recovery suites, and that enables us to provide the best possible care for our organ and tissue donors.
And typically that all had to be done at the hospital, right?
Yes.
Okay.
It does. And we do still do some recoveries at the hospital, but our recovery center here allows us to save more lives. It reduces our travel time for transplant teams, minimizes preservation time for the organs. It also creates a more positive experience for donor families. They don't spend as much time waiting at the hospital, waiting for the patient to go to the operating room. And it certainly also decreases healthcare costs. Costs typically are paid by the transplant community, and that includes private health insurance and the Centers for Medicare and Medicaid. So those costs get reduced by moving them to our facility.
Okay, we talked about your swift response after COVID-19, but you also had some new strategies in place even before the pandemic hit that you think has helped during 2020. Can you tell us about those?
Right. We are working very closely with our hospital partners to increase our donor referral rates. For example, in 2020, our hospital services team tripled in size, and they made quite a big, significant changes in an effort to improve the donation process for our clinical partners. We've also been coordinating more cases of donation after cardiac death. We increased our age range to allow people up to age 85 years old to become donors. And then we're also going on site into the hospitals much more frequently than before to evaluate patients to be potential donors.
And could you explain how Indiana really is unique as far as the growth in the transplants in 2020, especially when you compare it to other states, right?
Well, certainly, yes. I think everyone has continued to grow a little bit this year, but growing by 30%, 31% in 1 year is just absolutely astounding. Fortunately for us, we have, the generosity of Hoosers who've signed up to be donors. But despite our record-setting year, there's still more than 100,000 people waiting nationally for a life-saving organ transplant, and more than 1,300 here in Indiana alone. So one thing that we always want to make sure that we share with people is to register themselves to be donors. You can do that at the BMB or on indianadonornetwork.org on our website. So.
Okay, just a few seconds left, but we're in the thick of another COVID-19 surge here in Indiana. Do you feel more confident going into this now from lessons learned earlier in the pandemic?
Certainly. I think hopefully, this pandemic isn't going to continue for much longer, and that hopefully this little spike that we're having is going to go back down. But we've certainly learned a lot over the last, 8, 9, 10 months or so. And, we just want to encourage people to continue to give and share life with others.
All right, Kelly. Well, a successful year, and I know it's sacred work you do there. Thanks for being on the show and sharing your story with us.
Thank you so much for having me.
Gary, back to you.